As a stroke neurologist, I strongly believe that educating the community is the key for a healthy society. As our population is growing older, we are seeing more and more strokes. Learning how to recognize the early signs and symptoms of stroke and take a proper action immediately is just as important as controlling the risk factors. The sooner you get treatment, the better the outcome is. We say, time is brain, and we mean it. Think about this. For every minute of lack of blood supply to the brain, you can lose up to 2 million nerve cells. And for every hour of lack of blood supply, the brain would age by 3.5 years. So please stay with us and learn the signs and symptoms of stroke.
The acronym FAST is an easy way to identify the most common symptoms of a stroke. F stands for face. Ask the person to smile. Does one side of the face droop? A stands for arms. Ask the person to raise both arms. Does one arm drift downward? S stands for speech. Ask the person to repeat a simple sentence. Is their speech slurred? And T for time. If you observe any of these signs, call 998 immediately.
The majority of the gains will occur within the first 3 to 4 months after a stroke. However, many survivors will continue to recover well into the first and second year after a stroke. Caregivers should consider assistance from an occupational therapist and physical therapist after a stroke. They should be aware of any imbalances which could result in falls, inability to walk, and difficulties taking part in or completing daily activities.
Last but not least, pay attention to mental health. Post-stroke depression affects as many as 30 to 50% of post-stroke survivors. Depression can significantly affect your loved one recovery and rehabilitation. Stop depression before it hinders recovery. Consult a healthcare provider to develop a plan of action.